Welcome to the NTT Health and Wellbeing Podcast, a show exploring the digital transformation of our everyday welfare. On this episode, what factors determine a person's ability to access professional healthcare in the United States? Lisa Esch, Senior Vice President at NTT DATA Services, is joined by Dr. Lisa Fitzpatrick, founder and CEO of Grapevine Health, for a conversation on how digital technologies may diminish the gap of health inequity. Together, the pair begin to answer a question that is both simple and complex. Healthcare for whom?
So today I'm here with Dr. Lisa Fitzpatrick, founder and CEO of Grapevine Health. Welcome, Dr. Fitzpatrick. Can you share a little bit about your background?
Sure. Hi, Lisa. I am a medical doctor trained in public health at CDC, and I had a long career at CDC in a variety of positions. But when I left CDC, wanted to be much closer to community, so I took an academic position at Howard University Hospital, and that's where I really started to engage with the community in a very intensive way. And one of the things I learned, although I've known it for some time, is that people feel very disconnected from the healthcare system, particularly people from underserved communities. They find it often disrespectful, overly complex, and intimidating. So I wanted to try and do something about that.
Well, that's great. And your story is going to unfold as we spend the next few minutes here. I can't wait to hear more. So you've made this change in your career and really are serving your community in a new way. The COVID-19 pandemic taught us lots of new lessons, but in some respects, it tragically highlighted some truths that we already knew, but probably truths we didn't want to talk about. For example, we all do not experience healthcare equally, and that has really come clear over the last 18 to 20 months. Are you able to provide an overview of the key determinants of healthcare inequity?
Well, I think there are lots of different ways to talk about this, but I think historically, we've known about these disparities. I think we're talking about them a lot now because of the pandemic and how obvious it is. You can't look away from the disparities in front of us, with Black and brown people dying at higher rates than everyone else, and also having higher background rates of COVID-19. And for a lot of reasons, we're seeing these increased case rates in the Black and brown community. It's not just that they're more likely to be frontline workers who are then always at risk for transmission. But I think there are some things we don't talk about related to why the disparities exist, not just now, but before. And that is, it can be very stressful to be a Black person or a brown person in America. We've heard a lot of talk about racism and injustice. And so think about all the decades we haven't really talked about that, yet people were enduring the trials and tribulations associated with facing racism or even poverty. Most of the people living in poverty in America, a lot of them are from Black and brown communities. And so all of these things converge during something like a pandemic, and it becomes so obvious and so blatant that you just can't ignore it anymore. Lately in the healthcare system, we've been talking a lot about social determinants of health, whether or not people have access to food, transportation, housing, really those bottom of the pyramid resources that we talk about we've been talking about forever, but really not connecting them to people's health. And while those things are really important, really the root of this is poverty. And that is something that we won't solve overnight, even after this pandemic is over. It's, a long-term effort, but it starts with just the awareness that this is contributing to people's health outcomes.
Thank you for that perspective. It's interesting as we've had to really adjust how healthcare is delivered, how people access healthcare. Technology has played a really large role in the changes that we've seen. Yet technology can also be the divider when it comes to access. Where there is health inequity, it can make it worse sometimes. Sometimes it can solve it, but sometimes it can make it worse. How do we have health equity and tech equity across the board? And it really isn't just access. If you think about, not everybody has the internet that they can connect to even do school. We saw the impact of kids that had to do school from home and didn't have the technology and the access to do school from home. But with healthcare, there's also like a usability along with access. How has the technology gap really exacerbated health inequity?
It's a really great question, and I appreciate you raising it because we need to raise awareness about this issue broadly. The issues around tech disparities are not monolithic. So most of the time, you'll hear people talking about the need for access to broadband. And while that's true, especially in the Deep South, people need access to consistent broadband, but people still have access to technology using their smartphones. So while the disparity is really striking and impactful in the education sector, I think in many ways it has the potential to be much less so in health because people do have access. They're able to video chat and send text messages, make phone calls, get on the internet just using their smartphone. There are bandwidth issues sometimes, but we've seen during the pandemic, people can get around those by turning off their video or converting to a phone call. So I think the conversation about tech equity or tech equity is worthy of a much broader discussion about what that really means. Because in the tech innovation world, most of the technology is being developed for people who have the fanciest access. And that means they're not designing for people who have less fancy access. So if someone can only text consistently, what sorts of healthcare access points do we have for people who prefer to or can only text? And so this is an example of why we have this tech disparity, because we're not building solutions for the kind of tech people have. And I give an example all the time about this mother who was frustrated that she'd bought her daughter a laptop to do her schoolwork, but she wrote her term paper on her smartphone. So that just gives you, some perspective about how devoted people are to using their smartphones. And for some people, especially a lot of our underserved communities, the smartphone is a lifeline. I've seen people filling out job applications on their phone, doing research on their phone. So for the time being, I think we expand this conversation about what is tech disparity, but not just talk about lack of access to broadband. Talk about digital literacy. Like, do people understand how to maximize the use of their phone if that's all they have? So I really want us to focus on sort of building the ship as we sail. Sure, we need to expand access to broadband, but in the meantime, let's help people and maximize the use of the current tech they're using.
That's a great perspective. And, the phone being the lifeline so many times in communities, no matter, where you're at, it's an amazing technology that can actually help us move forward. But I think you're onto something when we look at the technology that's being developed. You're right. It really is for much more sophisticated types of technology to use. So when you first think about healthcare technology and health equity, many people probably immediately, we all think of telehealth. We went to telehealth. We started engaging with our healthcare providers via telemedicine, telehealth. How important has telehealth been during the pandemic? And do you think there's limitations? Are there limitations with it, especially when we're trying to tackle the access and the lack of healthcare provision, maybe in communities that don't have the resources that they need?
Yeah, I think healthcare was transformed during the pandemic as a result of access to telemedicine services. I think they were not equally distributed for some of the reasons we mentioned. I mean, in some places, it is difficult to have a video visit with the doctor if you don't have enough bandwidth on your phone. We saw a lot of people don't have access to laptops or tablets that enabled the ideal visit, but people could still revert to phone calls and even in some cases text messaging just to ensure your triage and make sure people weren't in crisis or had an emergency condition. I did some work with one of our local hospitals, and we learned, particularly among seniors, we really need to focus on digital literacy. So helping seniors become proficient and more comfortable with using technology, because almost all of them had to rely on a child, a neighbor, or someone to come and help them navigate or negotiate getting online for the first 2 or 3 visits. But to answer your question succinctly, yes, telemedicine really enabled access during the pandemic, but there's still a lot of need out there that we weren't able to meet as a result of these limited access to adequate bandwidth.
Yeah, and you talk a lot about health literacy as well as the digital literacy. There's just been this acceleration of that and using technology with the health literacy and simplifying the words that the healthcare providers use with people and with their patients and how we engage. Do you think technology has helped with some of that health literacy that's also needed?
Absolutely, it has, but it's a double-edged sword because
Yeah.
the misinformation is also as abundant as the accurate information, and sometimes people don't understand how to differentiate between them. And we're seeing that most acutely with the vaccine misinformation. So a lot of the vaccine hesitancy is related to misinformation people are getting through technology, meaning using their phones to search online or on social media. And they're hearing that the vaccine is killing people or maiming people, or because the vaccines were rushed, we don't have enough science to warrant giving the vaccines to people. So it's going to be an ongoing battle. Social media and the internet are not going away. So our job is to find ways to populate the internet and social media with accurate and trustworthy health information to try to combat some of that negative information.
Yeah, and
misinformation.
The misinformation, and I think one of your videos was addressing a myth on drinking hot water and killing the COVID virus. And I think what was so important about that video is that you talked about how there was probably some truth rooted in that concept initially and how it just got twisted and it turned into something that most likely, that wasn't true. So I think the way you're using technology to educate and really empower the community is also, it's really helpful. But that health literacy, understanding, helping our communities sort through the myths with the facts, we can use technology to do that. But I love that video. I love that little video.
Yeah, I talk about that all the time because it's not surprising that people are confused. This information is very complex. And during the pandemic in particular, there have been a lot of conflicting interpretations of the data. Mm-hmm. And the data have been changing, which means the messages are changing. So if you have, a population of people who pre-pandemic didn't really focus on science and research and care to really understand much about the details of these things, all of a sudden they're drinking from a fire hose and trying to sort out what sounds plausible to them. And so the information, as we call our company is called Grapevine Health because so many people get their health information through familiar sources like friends and family. And so once that information is a little distorted and as it's passed down, like the game of telephone, you come out with something completely garbled on the other end and people don't know the difference because it still sounds credible.
It really does. There's like a nugget of truth probably in there somewhere.
Mm-hmm.
And just empowering people to help them sort out. But I think you're onto something as well, is that most people had really never had to understand science in the way that, we're being inundated with facts or, information, and also how data is interpreted. The same data can be interpreted in different ways. And if you haven't spent your life in the profession, it seems very confusing. So it's good. So let's switch gears here a little bit and talk about maybe some of the specific technologies that you believe can either be improved upon or implemented on a much larger scale to improve health access.
Well, first of all, I am biased towards text messaging because I think it's the least common tech denominator, especially if you're trying to serve underserved communities. And so most of the health tech innovations shy away from text messaging because of their concerns about HIPAA. And my response to that is we need to be more trusting of our patients or community members to have the sense to tell us whether or not they're okay sending their information over text messaging. It's very convenient for them and they like it. So I think we have a long way to go to innovate using text messages. The US is really behind because if you go to places like India and Africa, where they have been delivering forms of healthcare via text messaging for a really long time and very effectively, it just shows, how much we need to flex to better support people. I also think we need fewer apps. And, that the reason for apps is related to my comment about texting. People believe in order to be HIPAA compliant, you must have an app that then directs someone to a website. Well, for some people, that's too many steps. And so we talk about meeting people where they are. We hear that slogan all the time. But if you're meeting someone where they are and they don't have an email address or they can't get on the internet consistently, and then you have them download an app, which takes up a lot of bandwidth on their phone. And then once they get in, then they have to click 2 or 3 times and do 2 or 3 extra steps just to get connected to someone. So I think the systems are too cumbersome. And then finally, I think, like you're saying, us use video with through our work at Grapevine, we have to find ways to relate information through video. I was talking to someone yesterday about how I don't read books like I used to. And we realized it's because there's so much access to video, all the streaming. And there's something about streaming that seems to be more relaxing than reading. And I hate that because I'd love to get back to reading books. But the reality is nowadays, this is how people are consuming information. YouTube is the second largest search engine after Google. So there's a reason for that, because people want to consume information using video. So video is probably the future of education if it hasn't already overtaken our other forms of education.
Great. Thank you for that perspective. So along the lines of health literacy, it's vital to really ensure health equity. And how do you approach the literacy issue? We touched on that just a little bit. And what role do you think technology plays in solving that issue of health equity?
I think you first have to look for literacy because the signs are very subtle, and it can be very embarrassing for someone to admit they have a literacy problem. And in the health system, we are not very friendly towards people who have low literacy. I interviewed a gentleman a few years ago. I talked to him for almost an hour until I realized he couldn't read. And the only reason I realized it is because I asked him if I could send him text messages. And he kept referring me to the phone saying, call me. No, just call me. You don't have to text me, call me. And finally I asked him if I said, do you have trouble reading? And he said, yes, I do. I never really learned to read. I only went to the 3rd grade. And so immediately I thought, this is the reason it's difficult for him to navigate healthcare. think about how many forms you have to fill out and how much you have to read
Right.
to go to a primary care visit. So I think we have to be intentional about looking for it and assessing, and then having the resources and the training and experience really to respond to people who need that level of support. And we have to do it without judgment and shame so they feel comfortable accessing and staying in care.
Wow, that's an amazing story for this day and age. Wow. And I don't think that we overcomplicate access to healthcare.
Mm-hmm.
I mean, think about how many duplicative forms you still have to complete. You do it in paper and then they upload it and you have to do stuff digitally. It's very, very complicated to access at times. And it's interesting. Now, organizations, so you're really touching on how the organizations, we have that complicated process to engage and what it takes to engage. You're starting to hear healthcare organizations, though, talk about health equity. What's your sense of sort of some of the virtue signaling that we're seeing? A lot of people talking about it, but where are people really able to take action? Like, what can they do?
Well, thanks for asking the question, because you're right. It is getting a lot of lip service right now. We change these terms every now and then. So before, the vogue term before this was health disparities, but essentially we're talking about a lot of the same things. I think throughout organizations, there are different ways to address this, but starting at the top, there has to be a willingness and a commitment to holding ourselves and people throughout our organizations accountable for achieving health equity. We also have to agree on what that means, because for some people, health equity means everybody has access to the same types of healthcare all the time when they need it. But others might say, well, that's impractical. That's not what it means. People need to have access to a good outcome. So whatever it takes to get to a good health outcome, that should be available to them. And so the first step is just defining what we mean within our organizations, when we talk about health equity. The second is, how do we measure it? Like, what does it look like? How do we know when we've achieved health equity? And I think that's the hard part. That's why it's easier just to talk about health equity, because if you peel the onion on health equity, you'll get back to the things I was talking about earlier, these social determinants, so the social drivers. People are working 2 jobs, they're living in poverty, they don't have enough food to eat, and so on and so on. And then it becomes too big and you feel overwhelmed. And maybe you say, well, that's impossible. I can't address all of those things. But this is where collaboration comes into play. It's critical for us to work together, because no one organization or entity can do everything.
Right.
So I think my final point about what organizations can do is, we've seen an abundance of new positions created around health equity. And this is similar to the diversity and inclusion. I won't say it was a fad, but we have these moments in time where things become very vogue and everyone's talking about them. And so they create positions. That's a great start, but those folks need to have the authority. They need to have the budget and the support to make their initiatives and their efforts successful. And so that's the final thing I think leaders in particular can do. If you are going to establish a department and create a position focused on health equity, that person must have a significant enough budget with a team of people who can support them to realize their agenda.
Great perspective. I appreciate you sharing that. And the next piece about health equity, you've talked about poverty being the root of it. Access to healthcare and its affordability, it's an issue for everyone, and particularly in our underserved communities. Can technology help bridge this wealth gap that happens for access? Is there something there that technology can help close?
Well, that's a good question. I think there's definitely a connection between financial means, financial literacy, and health outcomes. And so, if there's a way for technology to bridge those things, the financial wealth and the physical health and mental health, I think there would definitely be a lot of value in that. I actually haven't thought about this in this way, though. So, yeah, I'm not sure. It's a great question.
Okay, well, we'll see. I mean, the world's changing quickly, and can technology help, close that gap? We will see.
I would suspect if there were job creation related to technology that could help people close the wealth gap, that would be one way. But beyond that, yeah, I'll have to keep thinking on that.
Okay, great. Well, looking ahead, you've touched a little bit on this. What does perfect health equity look like, and is it achievable? Like, what is the world you are striving for?
Well, I don't want anyone to become sick or be hospitalized simply because they don't understand something or they don't know basic information about how to take care of themselves. And so once you have that, I want people to feel comfortable and welcome in every health system. So if they have a problem, there's someone there who is greeting them, with compassion and empathy, so that they are listening to understand what the challenges are and how to help people. Because I think, we talk a lot about why people don't engage in healthcare. For many people, it is not a positive experience. So I think that could transform the way we think about health equity and the outcomes we see if people just felt comfortable and they trusted the health system, like it was their friend or family member. So instead of going to the Grapevine, they would feel just as comfortable going to someone in the health system to help them solve their problem. And I think you could see a lot of these gaps close if people, I would say in the health system, if we acted in a more trustworthy, respectful way of everybody, regardless of income, background, zip code, to meet people with the services they need to be healthy.
That's great. Thank you. Thank you. So my final question to you is, what are the stakes of this conversation, especially considering COVID-19 pandemic and a renewed attention to the public health crisis? What really is at stake here if we kind of continue on our path rather than try to, address these issues?
Well, I think, people tend to have a very doom and gloom scenario about the future if we don't make changes. But to be honest, we've been staring at these problems for a very long time. I think what's different, in the future is, the cost. Like the cost of healthcare will continue to escalate. It'll consume a much higher proportion of our GDP. It's already very high. And the cost will just continue to go up. But I think we will continue to see health disparities, health inequities, and have this conversation until we're really intentional about addressing the social factors that influence whether or not people are healthy.
Great. Well, thank you. Well, thank you so much, Lisa. Really appreciate the time today in this conversation. And I think you've highlighted some key takeaways, some things for us to be thinking about as we're all engaged in healthcare, the transformation that we're seeing in the industry. There's some core things we can do in our community today, from how we interact, how we're thinking, where technology can contribute to solving this problem versus create a greater divide. And I appreciate you sharing your thoughts with this. I'm Lisa Esch with NTT DATA Services, and I appreciate the time today. Thank you.
Thank you for listening to the NTT Health and Wellbeing Podcast. For additional resources and to continue this conversation, please visit www.global.ntt/health and wellbeing.